Pain and bleeding in early pregnancy. Pain and bleeding in early pregnancy are common. It affects about 2 in every 10 pregnancies and can be a very worrying time. A lot of women have light bleeding, or spotting, or mild crampy pain in the first 3 months of pregnancy. However, vaginal bleeding and pain in pregnancy should always be checked by a healthcare worker. Especially if you have heavy bleeding, similar to or heavier than your period, severe abdominal pain or pain that doesn't go away with simple painkillers, bleeding with dizziness, fainting or shoulder pain. Your healthcare worker will ask you some questions and sometimes examine you. This can be by feeling your tummy, abdomen, and sometimes checking the neck of your womb, cervix, with a metal or plastic tube, speculum, inside the vagina. Your healthcare worker might do a urine test, blood test, or ultrasound scan. The scan can be through the tummy or an internal, transvaginal, scan. Vaginal bleeding can sometimes be a sign of miscarriage. A miscarriage is when a pregnancy ends before 24 weeks. Sadly, early miscarriage is very common. We don't know why most miscarriages happen, but it is not your fault and no one is to blame. Most women who have a miscarriage do not need treatment. However, sometimes medications or a small operation are needed if there is pregnancy tissue still inside your womb. This is because there is a small risk of infection or heavy bleeding, which can make you unwell. Pain and bleeding in early pregnancy can also be a sign of an ectopic pregnancy. This means an out-of-place pregnancy, in which a pregnancy grows in the wrong place, usually outside of the womb, in the fallopian tube. Ectopic pregnancy can be very dangerous if it is not treated quickly. Symptoms can include bleeding, tummy pain on one side, pain in the tip of the shoulder, discomfort when passing urine or pooing, dizziness or fainting. Ectopic pregnancy can be treated with regular checkups, operations, or medication. Your healthcare worker will advise you which treatment is right for you. If you have bleeding and/or pain in the early stages of pregnancy, you should seek medical advice urgently. Remember, the worrying symptoms are heavy bleeding, severe abdominal pain that doesn't go away, bleeding with dizziness, fainting or shoulder pain, and bleeding after 3 months of pregnancy.